Good morning. As always, thanks to Jay and Vicky for being here. I'm noting that Jay's got a blue shirt on today. It's throwing me off, all this color back here, because he's usually in black. Anyway, I think it was dark when he got dressed this morning. So anyway, thank you for being here. We're going to go right to the numbers. So in Hamilton County, we have seen 74,809 cases of COVID-19. Oh, I'm sorry, that's our old number. It's 75,574 cases of COVID-19. The increase from last week is 765. Hospitalizations are up to 2,758. The increase from last week is 46. And deaths are over 1,000. We're at 1,130. The increase from last week was 34. So, always very sobering to read those numbers. The better news is that many people are getting vaccinated. So, 201,118 people in Hamilton County have started the vaccine process. So that's just about 25%. So 1 in 4 Hamilton County residents have received at least one shot of COVID-19 vaccine. So that's great news. We're certainly getting there. But the situation is a bit mixed. We're at a bit of a plateau right now, and Greg's going to talk more about this. But we have seen dramatic decreases recently, and now we're kind of stuck. And so Greg's going to illuminate on that point a little bit. So that should, we need to note this and recognize that while we are making a great deal of progress when it comes to the vaccine, there's still a lot of COVID-19 in this community, and so we need to continue to wear the mask, socially distance, wash our hands. I know people are sick and tired of hearing that message, but the truth of the matter is we're not quite finished yet, and we're still in the steady run portion of the marathon, and we have not crossed the finish line. So, the weather's turning. It's a bit of a rebirth here in Hamilton County. The weather's nice, the flowers are blooming, the kids are back in school, activities are starting to happen again outdoors, people are getting together outdoors. Please continue to practice some of these safe practices to make sure that we continue to be safe until we have more vaccine in the community. So this time, for me personally, it's exciting, but it's also rather unnerving. So again, it just encourage people to be vigilant. So I've been asking Greg about the vaccine distribution here. So we've heard a lot about distributing methods and who's getting the vaccine, who those providers are in our community. But I don't think we've really focused much on the amount of vaccine coming to Hamilton County. So I've asked Greg to put a chart together so we can understand the gradual increase that we're seeing in vaccine. Because as you know, when people get frustrated about not being able to get in the queue to get a vaccine, that's all about the scarcity. We still do not have enough vaccine in this community to make sure that all those folks that are eligible get a vaccine. And the eligibility is widening broadly as we go, and it's about to kick up to those over the age of 16. And so as that happens, we want to remind people that we've got significant scarcity here in this community. We're doing better, we're getting more as we go, but we are certainly not there yet. According to the governor, and I've spoken to the governor about this, we are due to have quite a few more vaccines coming here in the next few weeks. We're not quite there yet. So also, Greg's going to talk about all of that. I'll remind people, in order to get information about who's providing the vaccine and in order to get contact information to get in line, please go to testandprotectcincy.com. All the information is there. If that is, if you don't have internet access or prefer to talk to somebody, call 211. And that leads me into my next talking point. I only have two. So help on the economic front is coming. The American Rescue Plan is on its way. So Hamilton County is going to receive $159 million from the federal government to help us build back better in our community as we emerge from the COVID-19 crisis. So we, last time we got it was $142 million. And we worked very quickly to get those dollars out into the community to address immediate needs. Those things were rent assistance, utility assistance, small business assistance. We rehoused the homeless population. We responded to the needs of the nonprofits and the arts community in Hamilton County. We did a lot of work in this space. Public Health was a recipient, so they could do contact tracing and buy the vans that we've talked about in the past. So in this round, it's coming in 2 tranches, and we have a longer period of time to spend these dollars. And so we need to be well informed as we go into this next round. And so Moira Weir is going to be on today to talk about how it's going over at 211. She is the director over at United Way. They have been very generous in working with the county to stand up a 211 navigation process to help people get in line for the vaccine, but also to provide some additional support services for those that need that as they quarantine for COVID-19, and now help people navigate some of the assistance that's available now from Hamilton County and will be available in the future. But in order to make good decisions, we need to be well informed. And so Moira's team is hearing those concerns every day as people call into 211. And so I asked her to come on today to talk to us a little bit about how it's going and what she's hearing, so that we can start to understand what is going to be the best use of those dollars. Those dollars aren't here yet, they're coming, but as a committee, and it's of course all 3 commissioners making these decisions, but I'm hoping that we can start talking about that through Moira to understand the needs that are out there. So before we get to that though, Health Commissioner Greg Kesterman is going to run through the numbers and the trends.
Good morning. I'm excited with our community's continued progress towards ending this pandemic. As Commissioner Driehaus just said, 1 in 4 Hamilton County residents have now received their first dose of vaccine. So that is huge. That's a big milestone. Before I get into the numbers, I wanted to just remind everyone about testing. There is still opportunities here in Hamilton County through the Test and Protect program to get tested. If you're feeling ill, please get tested before going out. It's really important to make sure that we don't spread COVID and that we continue to end this pandemic. I'd like to take a look first at the case numbers here in Hamilton County. As mentioned previously, our last peak was on December 10th, when we had about 716 cases per day. We are now down around 102 cases per day for the last 7-day average. Looks like we've kind of plateaued a little bit right around the 100 cases per day mark. I'm hopeful that we can continue to see this number come down, but right now, the last couple weeks, we've been very close to 100 cases per day. There remains about 3,300 cases of active COVID within our community, which still leaves a lot of opportunities for people who are letting their guard down to get sick. So just a constant reminder, we need to continue to be careful. Today's reproductive number in Hamilton County is 1.04. As mentioned last week, this mirrors case numbers. So since they've kind of flattened out or plateaued, our reproductive number has kind of stalled right around 1. In addition, our hospital systems continue to be at a much more comfortable level. Today, within our intensive care unit, we have today within our 14 county hospitals, we have 159 patients, which is represented by the orange on the chart. Within our intensive care unit, represented by the blue, we have about 45 patients within the ICU. So we'd still like to see these numbers come down more, but at this point, at least our hospital systems are at a level of staffing that is necessary to provide the best level of treatment to the public. Moving into vaccine, we still have 3 very highly effective vaccines here in Hamilton County. All 3 do a wonderful job at what they were designed to do, which is prevent COVID, reduce serious illness, prevent hospitalizations, and cut down on deaths, reduce deaths. So all 3 are doing an excellent job at what we brought them on to do. Week after week, we continue to see more vaccine coming to Hamilton County. I have a slide kind of showing what the last month's worth of vaccine allocations looks like. And this week, we are receiving 26,000 doses of COVID vaccine. In addition, we know that some of our pharmacies, including some of the Kroger pharmacies, are receiving direct shipment from the state of Ohio. This represents another 6,000 doses. And we have a regional mass clinic site at the Cintas Center, which is getting between 10 and 15,000 doses coming up. So Hamilton County as a whole is getting more than 45,000 doses of vaccine, which I think is extremely important because we now know that eligibility in Ohio is opening up to everyone over the age of 16. Over the last week, I've had a lot of questions. Governor DeWine basically indicated that we should fill all appointments and not let any appointments go unfilled. Here in Hamilton County, we've had such a need and desire to be vaccinated. All of our appointments, and really, quite frankly, all of the providers in Hamilton County have had their appointments full for this week. So we're not having a hard time filling them, and we're really not having to scoop into the 16-year-olds to fill those appointments. But moving forward, if there's an appointment available, anyone is eligible to fill that appointment. As mentioned, 1 in 4 people in Hamilton County have been vaccinated. In addition, more than 2/3 of those over the age of 65 have been vaccinated. Once again, this is huge news because I think this is the population that has had the hardest impact. They are the population that have ended up the most sick with COVID-19. So I'm really excited to see that progress, and we're excited to continue to make sure we can get vaccine for that population and anyone who wants it. I would encourage folks to remain patient. Anytime we open up large eligibility groups, we know that there's going to be a lot of demand, so it will take time to fill those appointments. Governor DeWine is encouraging folks to shop around for appointments. If there's no appointments in Hamilton County, it is okay to travel to get your vaccine. We want to make sure every dose gets used in the state of Ohio. As we're waiting for more folks to get vaccinated, I really still encourage everyone, please don't let your guard down. The weather's nice, there's lots of new opportunities outside. Continue to social distance, continue to wear your mask, wash your hands, and if you feel ill, please stay home. Thank you very much.
Thanks, Greg. I want to follow up on one thing that you talked about, which was Cintas. So I've been bragging a lot about Hamilton County Public Health, about the process at the Board of Elections. I went and got my own vaccine last week, I guess that was. It went very efficiently. People were so generous, so kind. Everybody was following the rules, and it went very smoothly. I visited the Cintas with the governor last week, and same thing. Cintas is huge, as you know. There were thousands of people streaming into that facility to get their shots, all very well organized. Nobody had to stand right on top of anybody else, and so Kroger is the partner there, and Xavier is also the partner there because Cintas is obviously owned by Xavier, and so they were there to greet the governor, and it's this great collaboration. And so I just want to point out that is happening like on all fronts. The city is doing it, the county is doing it, the private sector is doing it. So thanks to Xavier and to Kroger and to the state of Ohio and the governor for providing that mass vaccination site here in Hamilton County. 10,000 doses were distributed over a 3-day period, and we're expecting 5,000 every week now continuing. So that's a tremendous partnership, and we're very grateful. So with that, we're going to turn to Moira Weir, who is the director. Moira, I hope I've got your title correct, over at the United Way. I feel like it's probably longer than that. But anyway, thanks for being here. And again, we're hoping that you can illuminate just a little bit of what you're hearing when people are calling into 211 so that we can be better informed about the needs on the ground. And you are muted at the moment. We're
booted just to make sure she had it on, so we might have some technical difficulties here.
All right, we're experiencing technical difficulties. Let's give her 1 minute, and otherwise we'll go to the Q&A and come back to Moira. My expectation is that she's rebooting right now.
Can you hear me now?
Oh my goodness, there she is. All right, Moira, we can hear you.
All right, sorry, I'll get my video back to you. All right, sorry about that. I've had a little bit of issues this morning. So so since we've been taking calls since January about the vaccines, we've probably answered more than 10,000 calls. And really, beyond the fact that we're trying to help families, certainly if they've tested positive, to make sure that we're distributing test kits, food, other necessities. But the call volume around what we're noticing and tracking, we'll have good data about this, we'll continue to track, is the needs are great, particularly around utility assistance, rental assistance, mortgage assistance, and obviously some small businesses are struggling with some things. So we really are trying to track all that to make sure that we can be responsive and make sure we're connecting people. And what's been really great about this partnership is we're actually able to talk to people live, and we're really committed to making sure that we have a live connection and they're getting information. And so what we're encouraging callers, that in the event that you get a voicemail, because as the call volume sometimes goes up and down, please leave a message, because we are returning those phone calls within 24 hours, so that we are making those connections. And we're also seeing pockets where we've seen we're tracking actually where needs are higher in certain zip codes. So we'll be able to provide the county with some areas that identify specific zip codes that have high needs as well in certain things. So again, lots of questions around rental assistance, utility assistance, mortgage assistance, and then just making sure that we make those connections and handoff.
Thank you. And Moira, we'll look forward to seeing some of those data points as this work continues. And the county has money available for relief, and I know that's been talked about, especially last week. So go to 513 Relief, and you can find that assistance, or call 211. We just allocated some dollars for small business assistance, for rent assistance, and for food assistance. So thanks again to you, Moira. I know there's a team behind you as well, answering these calls. I did sit in on one of them, and the kind of the generous spirit of the folks that you have working over there, people that are willing and able to connect with the folks that are really struggling in this community, means a lot.
No, thank you. And really, that website that you all created is awesome, because we are putting, asking callers also to go there. So it's a great partnership, and we're really getting good information out there. So thank you.
And I want to credit Commissioner Alicia Reese for helping stand that up and having the idea to put that together. All right. Well, very good. Thank you, Moira. Stick around if you don't mind for questions, and we're going to go to the Q&A.
Thank you, Commissioner. Jenna Cisneros from Local 12 is up first, and she has questions for Greg.
Good morning, Jenna.
Hey, good morning. Thanks for your time again. So real quick, just can you talk about the importance for this next age group that becomes eligible on Monday that's going to start receiving the vaccine?
So really, our goal is to get everyone who's eligible vaccinated. And so as we have now opened it up for more and more folks, I think it's great because we can start making progress. I fear a little bit that here in Hamilton County, because we've had so many people want the vaccine, that folks that have been eligible for a little bit who haven't gotten a vaccine are going to feel upset or disappointed, or like they can't get a shot. And we are going to make every effort to make sure that everyone who wants to be vaccinated here has that opportunity.
Thank you. That's all I need.
Thank you.
Next up, we have John London from News 5, and I believe his questions are for Greg.
Good morning, John.
Hi, Greg. So with the confluence of opening day and the Dora district that we've heard so much about and are anticipating tomorrow, you've got Easter coming up, the spring weather that Denise mentioned, and the COVID fatigue that you've mentioned in the past, how we're all feeling. How do you and the city health department ensure that protocols are followed given all that, and that the banks and the ball game gatherings that we're going to see don't turn into super spreader events?
Both health departments, actually all 4 health departments here in Hamilton County, will still respond to complaints that we receive. Generally speaking, though, John, I think the most important thing is for us as consumers and folks visiting these venues to make sure that when we visit, we feel safe. If you go to the banks and are out enjoying the Dora district, we have the ability to make sure that we as individuals are spreading out and avoiding other people. When you're not actually consuming a drink or a beverage, I would ask you to wear that, set the example for others. Similarly, at the ballpark, there's plans in place, very detailed plans to make sure that individuals are seated in spaced out ways. And I think it's just really important to support our businesses and make sure our businesses know that we're supporting the businesses that are doing a good job.
That image of Court Street after the Ohio University victory the other night sticks in my mind, and I wonder if you worry, or if any of you worry about the possibility. You know, the Reds opening day is always a big time of celebration for the city.
You know, there are so many positive indicators right now with regards to cases and hospitalizations that really leave us all with a sense of hope. And I do absolutely have concern that as we let our guard down as a community, that we will see increases in cases. And so I've had the same plea throughout the pandemic that we each take individual responsibility. We know from the protests that there were really no significant increases in cases, and we know a lot of folks wore masks. So if you're going to get together in ways that bring large groups of people together, we can do so safely. I think you still need to space out. I actually did not see the images that you referenced, but my hope is that folks would stay together in clumps of folks, that like family units or friend units that are already getting together, and wear your mask. Like I said, continue to set that example. The last thing we want in Hamilton County is to see an increase in cases and to have the state react to that by having additional restrictions. We want to continue to move this pandemic out of the door and get rid of it.
How do variants factor into planning for, you know, what's coming up?
So here in Hamilton County, we have, I believe, 2 variants at this time. And as I've said many times before, the variants, while they might spread easier, generally speaking, the prevention methods are the same. Wearing that mask, hand washing, social distancing, they're all very effective with the variants as well. So once again, that same message is critical for helping control COVID within our community.
We have a lot of people getting vaccinated, and more people are going to get vaccinated. And you know how young people view a lot of this. Do you sense that we might be in danger of losing the "Don't Let Your Guard Down" campaign?
You know, I think that's always a concern, that as people get vaccinated, they're going to quit wearing their masks and quit social distancing. We're seeing some new messaging coming from the CDC. A couple weeks ago, I talked about vaccinated families being able to get together. At the end of the day, we need science to catch up. This is the first time we've had a COVID vaccine in the history of vaccination. So the scientists are working really hard to understand what is safe. And as new information comes available, CDC will continue to adjust their rules and regulations and guidance so that we can do more and more. It's critical, though, until that happens, that we continue to be as safe as possible.
One more quick question, Greg. Given the worsening credibility and image of AstraZeneca, would you get that shot today if it was offered?
Ultimately, John, I fall back on what the Centers for Disease Control and the Federal Food and Drug Administration guidance comes out from the FDA. So as soon as the FDA says that AstraZeneca vaccine is safe, I would feel comfortable taking it. And the reason why is because the FDA has a rigorous set of tests and studies that they do before allowing for a vaccine to be available to the public.
Thank you.
Thank you. Up next, we have Ann Saker with the Inquirer. Ann, who would you like to ask your question to?
Thank you very much. Sorry to be unclear on that. I'd like to talk to Greg since he's standing up there at the moment. And then Ms. Weir, if she can make herself available in a minute or two. Greg, are we doing enough genomic testing in Ohio of coronavirus tests to even have an accurate picture of the variant situation in the state? I mean, are we flying blind on that? Or are you okay with the information we have at this point?
You know, from my understanding, both local labs as well as labs, the Ohio Department of Health, for additional genetic testing. And so I think it's important to have that. And could we have more? Certainly. But at the end of the day, the genetic testing is helping to identify something that we know is here in the state of Ohio, and that's variants. And we've been saying all along, there will be variants. We will see variants spread, and it's quite easy for these variants to succeed at spreading because COVID is so successful at making people sick. It doesn't change, though, the public health response to the pandemic. So having that information, having more information has always been useful, but I don't think it's going to change how we respond to this pandemic.
Right. So at this point, the problem is not so much a matter of biological study, but more a matter of psychological study, that here we are a year in, and we're still having to practice these methodologies of preventing transmission. Is there I mean, is someone thinking about how to freshen the message a little bit so that as we go into the Passover Seders that will happen and the Easter dinners that will happen, and 16 or 20 people show up at grandma's house or at mom's house, how do we navigate that for people? Or do we need to have everybody masked at the Seder table or at the Easter table?
You know, the message at this point is a year old, and even though there are several campaigns to continue to encourage people to wear their masks, at the end of the day, it really is about each of us as individuals making the safest choice possible. We have talked, Commissioner Driehaus and I, throughout this pandemic, have come together and talked about different ways that people can safely get together. I think right now the thing that we have going for us is the nice weather. We have weather in which people can safely get together outside. Large groups of families can get together and spread out and make good, safe choices. We know that COVID-19 is deadly. We know that it catches people by surprise. We know that there's hundreds of stories of people who didn't think COVID would impact them, and then they end up in the hospital with serious condition. And so the plea I make with each of us is don't let that be you. We want you to be safe. We want your family to be safe. And we know that we are working towards the end of this pandemic.
Thank you very much. And Ms. Weir, for a moment, if you could pop on here, and I wonder if you could, if you are able, I wonder if you could tell us a little bit about what you're hearing from the 911 calls about vaccine availability. Or who is the population that's making 211 calls to get a vaccine appointment, if you can describe them for us? Is she still with us? Perhaps not. All right, then I'm finished. Thank you very much.
And next up, we have Corey Sharber from WVXU.
Good morning, Greg. Of course, you mentioned that it seems like cases have plateaued at around the 100 cases mark. Of course, a lot of people probably take that as good news, considering where we were, just a few months ago. But that still means citizens are at a high risk of contracting the virus, right? Like, how should people interpret that information?
You're exactly right. I reiterate each week how many cases of active COVID there are. And this morning I said 3,300 cases. There is still a lot of COVID in our community. We have a lot of things going for us. As mentioned, 1 in 4 residents are now vaccinated. The most susceptible to COVID, the elderly population, or our senior population over 65, nearly 2/3 of them have been vaccinated. So some of these things, we're making really good metrics, and hopefully this will long-term impact the number of people that do get serious illness. But each of us must continue to be careful and continue to practice safety steps to protect ourselves and our family.
And of course, we were talking about the weather and how the season's changing and all that. I know Monday I was dying from allergies. I was wondering if you have mentioned this before, if you could go over if allergies can create a greater risk for people contracting COVID at this time.
So I don't think the allergies create a risk for people to contract COVID, but the serious concern I have is that allergies and COVID look a lot alike. And so there are tons of opportunities to get tested. And if you wake up today and you have a runny nose and you're coughing, please don't assume it's allergies. Please stay home. Please go get tested. The Test and Protect program is turning test results around within 1 day. And that's fantastic, because that means you're only missing 1 day of work, and you're able to know for sure that when you go to work, you're protecting your coworkers. So the biggest plea I have is please don't make an assumption that allergies, because it's spring and it's Cincinnati, that allergies are the reason why you're sniffly today. You're probably right, but if you're not, then you run the risk of spreading COVID to coworkers.
And you did mention that we see 2 variants within Hamilton County. Could you go over which ones those are and how many cases of the variants we have currently?
Yes, we currently have reported probably about a month ago 1 case of the UK variant, and that's the only case I'm aware of at this point. And we do have 1 case of the California variant as well.
All right, yeah, that's all my questions. Thank you.
Thank you. We got 1 follow-up from John London, and I believe it's for Greg.
Greg, yes, thank you. Not to beat a dead horse, but you said that the weather works as an advantage for outside gathering for families, and certainly that makes sense. You also have the outside factor, at this new DORA district that will come online. tomorrow. And what I would envision down there would be, since you can walk around with a drink in your hand, a lot of people not wearing masks, and maybe social distancing may become a little difficult if it gets crowded enough. What do you see as the risk factors if that's the situation, and what's the best advice for people who will be a part of that parade?
So we are able to go to places like that and gather safely, and I think it's important that as individuals we work really hard. You know, I think there's plenty of space downtown at the Dora District to spread out, and if there's an area that is crowded, I would ask each of us to take personal responsibility and spread out. Bring your small group to a different area down there so that there is plenty of space and so that there is not risk. It is going to be hard to encourage people to wear their masks. I know folks, when they're drinking, they can't wear a mask, but when you're not drinking, I would ask you to put it on and set the example, and realize that this is our tool for getting our community back to normal so we can get all of our activities looking more and more like normal.
Okay, that seems to conclude our questions from reporters.
Thank you. Thank you all for your questions. I just want to say that related to the Dora District, the Reds have worked really hard to make sure that opening day is going to be a safe experience. Both Greg and Melba Moore from the city, John Cranley, myself, Phil Castellini, we've all been working together to make sure that fans are spread out in the stadium and we can enjoy opening day as safely as possible. The Dora District is the same thing. I mean, remember years ago we passed that legislation. It was now Senator Blessing and myself to say, hey, can we carry a beer outside in a like an entertainment district like that? We're finally having that come online, but it's the same as every other holiday. You just need to use common sense and behave as though you've got COVID and the guy next to you's got COVID, right? And just keep a distance. I was out for St. Patrick's Day. We've discussed this. I'm Irish, and in both situations, we went to two different places. We stayed in a relatively small group outside at the one location. It was actually down on the banks. We're able to distance, no problem. And then we went up to Washington Park, and there was a celebration outside there, and we were under the heaters, and we kept it. We were with our group, kind of the bubble, and talked to people that weren't in our, but we put our, you're not drinking constantly, right? Put the mask on, say hello, engage, have fun. If you're going to take it, I mean, it's step away, turn your face. I mean, it's just not that hard. And so what we're asking people to do is try to be as responsible as you can be in a situation like that. We all know what to do. We've been talking about this for over a year now. Wear the mask and keep a distance from one another. So we're just hopeful that people will continue to behave in that manner to try to keep everybody safe. The last thing we need is a spike in Hamilton County. We're doing pretty well. We've plateaued. It's a relatively low number, but we're just hoping that these holidays don't provide for a spike in our community. So we're asking people to hang in there, basically, because like I said, it's kind of an exciting time of year. We're starting to feel energized and the weather's turning, but it's also rather unnerving. And so we just need to continue to be cautious until we get more vaccine out to people in the community. So thanks again. Appreciate the questions, and we'll see you next week.